According to a new report from the Centers for Disease Control and Prevention, insect-borne sicknesses have tripled in the last 13 years. Those are diseases caused by bites from infected mosquitoes, ticks, or fleas. CDC officials say nearly 100,000 such illnesses were reported in 2016. That includes diseases caused by 9 infections not seen before in the United States. The CDC also says the U.S. isn't prepared to handle such an escalation. CBS News Chief Medical Correspondent Dr. Jon LaPook joins me now. So, John, first of all, why are these illnesses increasing?
Well, there are a lot of different ideas, and climate change may be playing a role. So warmer temperatures can lead to a longer breeding season, and that can allow things like ticks and mosquitoes to spread geographically. Also, the world is getting smaller and smaller. There's so much travel. You remember during the Zika outbreak, there were infected travelers who came up to the United States from places like Brazil and Mexico, and they were able to do that because they got on planes or they were able to get here quickly. Lots of other reasons. You know, Dr. Peter Hotez, who's the dean, he's an infectious disease expert. He's the dean of tropical diseases at Baylor. He said that poverty is actually a risk factor. And it makes sense. You know, when we were down in South Texas during the Zika epidemic, we saw that there were places where there were broken screens. There were houses that had little puddles of water where the mosquitoes can breed. They don't have air conditioning. So these are factors that can also increase.
Well, what are some of these diseases and how dangerous are they?
Well, Lyme is a big one, and Lyme has increased. It's about doubled in the last 13 years or so. The recorded number is about 36,000. The CDC thinks it's much more than that, maybe closer to 300,000
Wow.
because of underreporting. And, you know, it's especially largely in the Northeast, but you're seeing it in other areas. Dr. Hotez was just telling me it's in Texas, it's in the middle of America, it's down south. So this is something that so many of us worry about, right, especially with our kids running around outside.
And the report comes with a warning that the U.S. is not prepared for such an escalation. Why is that?
Yeah, I think, you know, there was the yellow fever outbreak 100 years ago, and then the Panama Canal, and we were almost having it eradicated. We had a lot of resources, and then we kind of got lax. And our public health effort to try to combat mosquito-borne illnesses, for example, fell down. With the Zika epidemic, you saw increased funding, so we had a lot of money coming in for Zika, and I think public health officials are now really taking this they've always taken it seriously. Now they're getting some of the resources, and they're doing things like public education and also figuring out how to develop SWAT teams. So when you have an outbreak like we had in South Texas, they can send officials there and figure out where is it coming, how do we get the word out, and how do we clean up the puddles, for example, where their mosquitoes are breeding.
Yeah, because when you look at the numbers, I mean, just last year, nearly 100,000 people contracted insect-borne diseases. People are going to wonder, how concerned should they be about insect bites, and what specific steps can they take to protect themselves and their loved ones?
So one thing is the same thing we said during the Zika outbreak, which is use your common sense. So when you go outside, especially, let's say you're in a tick-infested area, cover up. Long sleeves, long pants, use insect repellent. You can go to the EPA website or the CDC. They'll tell you exactly which ones to get or the different choices. There's one tip from the CDC that I love, which is when you come inside from a tick-infected area, take your clothes, tumble dry them in a hot dryer for about 10 minutes, and that can try to kill any hitchhiking ticks. And then, of course, you know, you should take a shower, shampoo your hair, because the ticks can hide out there. And then one thing for parents, with kids, you have to really look at them when they come inside. And you have to look everywhere, even if it's awkward with your kids. You have to look where the moon don't shine.
Right.
Because those ticks can just climb up and they can go anywhere in your body. One last thing is symptoms. So if people are in a tick-infected area, you know, the incubation period can be from 3 to 30 days. They should look for symptoms like fever, rash, headache. Basically, if you're having any kind of symptoms, headache, fever, malaise, you just don't feel right, aches and pains especially, call your doctor and see if maybe you have Lyme. The last tip is that if you do have a tick, you know it's a deer tick, and you're in an area where there's Lyme, if you remove it within 36 to 48 hours, you can just take a prophylactic dose of medication. So it's like 200 milligrams of doxycycline once has been shown to dramatically decrease your risk of actually coming down with Lyme. The sooner you get it, the better, and you need to talk to your doctor about that, your other clinician.
All really important information. Dr. Jon LaPook, thanks so much.